I'm Daniel Nagasawa. I'm a neurosurgeon, so I do both cranial and spine surgery. The range of things anywhere from your basic minimally invasive microdiscectomies up to your redo complex scoliosis deformity corrections. I grew up in Los Angeles, went to Berkeley for undergrad, medical school down in UC Irvine, and then I did my neurological surgery training at UCLA. During that, I did an enfolded complex spine fellowship over at Kaiser Los Angeles Medical Center. So I got into neurosurgery, doing cranial and spine, especially the more complex stuff, in part because I love the challenge. I love to constantly grow. Medicine itself is not something that you can be complacent in. You can't just say, you know what I know, and that's good enough. You need to constantly be learning so that you can always do what you can to improve patient outcomes and get your patients as healthy as they can. I find neurosurgery is the epitome of the most complex thing that you could possibly be doing in surgery, and you're dealing with the nerves, you're dealing with the brain. So every micro movement matters. You need to be very sensitive with the nerves and sensitive with the brains because the patient's life, their quality of life, their functional outcomes, their ability to walk, all rests in your hands on that case. And so it's kind of high stakes, but the outcomes that we see at the end of the day is dramatic. So, I tend to be very conservative in general with my approaches to see if we can get them healed without having to do any surgery, because most patients actually can get better without surgery. So when a patient comes to see me in my clinic, they should expect to be treated as if they were my family member or a close friend of mine. I treat everyone as such because that's the respect and dignity that I would want for any of my friends or family who were to go seek help. And oftentimes in their most desperate hours where they're in pain, they're getting weak, they're losing functional abilities. And so I take the time to really get to know their story and hear what's been going on, to assess what sort of conservative measures they've tried, if any, assess their physical exam to see if they have any focal weakness or any more specific exam concerns. And then if they have imaging, we review the imaging together so that they can get a true understanding of what's going on. And then together we can talk about the plan, anywhere from conservative measures to some sort of more minimally invasive injections or things like that, to something more surgical intervention if necessary. My philosophy as a physician is to do what's best for the patient, to treat them with dignity and respect, and for patients to know that no matter what walk of life you're from, you're going to be treated with the same quality of excellent neurosurgical care that anybody else would. Some of the more common procedures that we do are minimally invasive microdiscectomies, where you're removing a small portion of a disc that's herniated, maybe a laminectomy where you're removing a small portion of the bone to decompress the spinal canal. I do artificial disc replacements in the neck to preserve motion when patients have some herniated discs or cord compression of the cervical spine. I'll do some spinal fusions of the neck as well as the rest of the spine when indicated. Actually co-authored a short book on the 7 myths of spine surgery, where we talk about all these different things that, maybe 30, 40, 50 years ago was more true of spinal surgery. But over the last decade, 20, 30 years, our technology has advanced a lot so that now we can do surgery in a much shorter time frame, much safer, and patients do a lot better. I love what I do. Neurosurgery is probably one of the more physically and mentally demanding occupations out there. Oftentimes we're in the trauma settings where time is function. If you have a herniated disc or you have pressure on the spinal cord, the longer that you delay things, the longer you wait, the less chance the patients have of recovery. One of the most gratifying parts about my job is in the post-operative period, both immediately when they wake up from surgery and they tell you, "Doc, this pain I've been suffering with for so long, it's gone. I don't feel any of that anymore." And then they come back, 2 weeks, 6 weeks, 3 months, a year or two later into clinic for follow-ups, and you get to hear how much better their life is. And you hear the stories of how it was before surgery and then afterwards, and what they're able to do, and the joys of their life that they were robbed of before the surgery that now they can go back to. That for me is what really makes the job worthwhile. So I've got a wife and 2 kids, and so they're my heart and joy. Spending time with them is the greatest moments of my life. We'll do some swimming and playing and hiking. going to Yosemite next week to do some camping and really get outdoors. I love the outdoors. We do lots of fishing and things like that. I'm also a professional magician, and so I do some of that at the Magic Castle, which has, I think, a direct correlation with fine and motor movements and dexterity and really perfecting a craft. Surgery is about trying to achieve perfection for your patients, where every movement that you do is meaningful, and you want the most perfect outcomes possible. And same thing in sleight of hand and magic, where everything has to be absolutely perfect or the trick is ruined. Same thing in surgery. You want your surgery to be perfect so the outcomes are perfect.